Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hello there, and welcome to this week's episode of the podcast. As always, pleasure to have you along for this week's episode. This week's episode is all about facial slimming, and in particular, we're going to talk about the muscle called the masseter. And this episode as well comes from a question that I've been getting from some of the clients that I've been seeing about the difference between treating a masseter, one of the main jaw muscles in the face, for temporomandibular joint pain versus facial slimming, because although there are some similarities, there are definitely some differences as well. And since this has been a common question, I thought I would do a podcast episode about it, answer that question, and then you'll have a little bit more information in case this is something that you are considering or you know somebody that is considering this treatment as well. So before we get into the nitty-gritty of how neuromodulators or Botox can help with facial slimming, I think we should first talk about the masseter muscle itself. The masseter muscle is one of the main muscles that is responsible for the powerful action of chewing. And it is the muscle that you can actually feel if you put your hand on the side of your jaw, closer back towards the ear, and then clench your teeth. You will feel a muscle bulge out slightly, and that is your masseter muscle. Of course, you have one on each side of the face, and these muscles are very strong muscles. In fact, sometimes they can be a bit overzealous. And this is the topic of one of my previous podcast episodes where we talked about how treating a very strong masseter can actually be very beneficial when it comes to treating pain in the jaw or in the temporomandibular joint, or the joint that controls the jaw. So by the way, if that is something that you are interested in learning more about specifically, then I encourage you to go back in the podcast catalog here and you will find that episode about temporomandibular joint dysfunction. Now, the other reason that we would treat a masseter muscle is for those people that want a more V-shaped face. Sometimes a bulky masseter can make a face look more square. And there's absolutely nothing wrong with that, but some people want to have that more V-shaped face. And in fact, some cultures find this more attractive as well. So for these people, it can be very beneficial to treat the masseter to cause some facial slimming. So think of facial slimming as a little bit of sculpting. We strategically inject the neuromodulator or the Botox into the masseter muscle, and this in turn relaxes the muscle. Now, this is where there is some similarity between the facial slimming treatment and the joint pain treatment, because both of them, of course, involve injecting neuromodulator into that affected muscle. In the case of the joint pain, relaxing the muscle means that muscle will not be able to contract as strongly, and that in turn can often lead to a decrease in the pain in the jaw, specifically in the jaw joint. For that type of treatment, there's a lot of variability here, but I'll just say for argument's sake, we could treat it with approximately 15 units of neuromodulator per side. Now, if you want to look into getting the treatment done for facial slimming, what we are essentially doing there is we are injecting enough of the neuromodulator to not only relax the muscle, but it actually causes the muscle to atrophy to a certain degree. Atrophy is the medical term for the muscle getting smaller. And when there is not as much action in the muscle, when there's not as much contraction, then the muscle gets smaller. Think of it as the opposite to when you're working out. When you work out and you're doing some biceps curls and you do that repeatedly, you're using the muscle a lot, and eventually you get hypertrophy or growth of the muscle, and the muscle gets bigger. In the case of neuromodulator or Botox, we inject it and it prevents the muscle from contracting, and in turn, the muscle gets smaller. Now, there is a fine balance between injecting just enough to have the muscle relax and minimize pain in the jaw, and injecting enough to actually cause the muscle to atrophy. For those that want to have a smaller masseter muscle and they want to have that V-shaped jaw, then we do inject a higher dose so that we can cross over that line where it's not just for pain control, but it's also for the facial slimming and the atrophy. So again, there's lots of variability here, but a ballpark, it could be 30 units, sometimes more than that, 35 units, 40 units to each of the masseter muscles on either side. Over time, as the neuromodulator starts to kick in, you will start to see a gradual decrease in the size of the masseter. And this is one way that we can reduce the squareness of the face. It's interesting, in aesthetics, we have lots of treatments where we add filler and we can add things to make the cheeks look a little more defined, or make a jawline look a little more defined, or make lips look a little more plump. But one of the few ways that we have to take away some mass in a certain area is to use neuromodulator, and again, to encourage that muscle to atrophy a little bit. Is there much pain with this? Well, not really. It's just like any other treatment. It involves tiny needles, just like as if you were getting the neuromodulator anywhere else in your face for wrinkles. You get the injection into the masseter, takes just a few seconds, and then gradually the muscle relaxes over a few weeks, and then you get the desired slimming effect. As far as recovery goes, there's not much to it. You can go about your day as usual. There's minimal downtime. You can come in over a lunch break, get this done, and that's about it. So there you go. That is a little bit about facial slimming when it comes to the masseter muscles. I hope you find that helpful. And as always, if you or you know someone that is interested in this treatment, then feel free to reach out to me. Again, my contact information is at antiagingvancouver.com, at drterryfisher.com, or my Instagram is at drterryfisher. I hope this episode has been both informative and enjoyable. And until next time, stay confident and keep smiling. I'll see you very soon. Take care.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.